Good afternoon, everyone. Thank you for joining us. I've got a major attack of imposter syndrome going on. I'm not a proper researcher, I'm just a vet who's done an MSc, but I'm hoping that this summary of my dissertation, which is a literature review, will be of some interest. We're all aware of the retention and recruitment crisis going on in the clinical arm of the profession at the moment. A survey done last year for the BVA and published in the Vet Record showed that 48% of vets are feeling burnt out, 37% are actively seeking to leave clinical work, 25% lack work engagement, and 20% were unable to cope with the stress of their work. Gudrun Rivets, who was the BVA president at the time, said, stress, burnout, lack of career progression, all leading to the leaky bucket of colleagues leaving the profession and leaving behind a recruitment crisis. So what is burnout? When I first started doing this research, I just had a vague idea that you got really run down at work and then you left. Well, there's elements of truth to that, but as you can imagine, the definition's much more specific, and it's actually quite debated as well. Christina Maslach and colleagues started studying burnout in the 1970s. They developed the Maslach Burnout Inventory, or MBI. They describe it as an occupationally specific dysphoria, which is a cumulative response to chronic workplace stress. They describe it as having three dimensions. There's the exhaustion dimension, mental and physical. There's depersonalization and cynicism, which is the development of negative attitudes towards clients and a distancing oneself from clients. And third dimension is the perception of inefficacy at work. Christensen and colleagues in Denmark in the 1990s and 2000s regard burnout as just the fatigue and exhaustion subscale. They decided the MBI wasn't really suitable for their Scandinavian populations for various reasons, and they see burnout as a metaphor being their flat battery. They developed their own scale, their Copenhagen Burnout Inventory, which measures personal, work-related and client-related burnout. The opposite of burnout is job engagement. That's where you feel really motivated by your work, you're full of energy, and you feel very strong and effective at work. The third model of burnout is the job demand resources model. This describes the balance between job demands, which take energy, and job resources, which provide you with energy, and personal resources come into that as well, such as self-esteem and proactivity. So that's what burnout is. What's burnout not? It's often spoken about in the same breath as compassion fatigue and sometimes used interchangeably, but actually it is different. Compassion fatigue has various debates going on about how it's defined as well, but it's agreed that it's from exposure to traumatized individuals and that it's a mild form of PTSD. Some people see it as regard it as secondary traumatic stress or moral distress. Others regard it as a combination of burnout and secondary traumatic stress. And the latter definition is what's measured on the ProQol measurement instrument. Carla in 2014 described the difference between compassion fatigue and burnout as being if you go and lie on a beach for a week, your burnout will go until you go back to work. But your compassion fatigue will still be there with the invasive and unwelcome mental images. It can lead to full-blown PTSD and also to anxiety and depression. The other thing that's similar to but not the same as burnout is depression itself. They both have major contributory factor being stress. They both involve exhaustion and social withdrawal. But the big difference, of course, is that burnout is context-specific to the workplace and depression is universal. ICD-11, which is the latest version of the International Classification of Diseases compiled by the World Health Organization, recognises burnout as an occupational phenomenon, but not as a medical condition. It's in the chapters factors affecting contact with healthcare services under problems associated with employment. And it uses the Maslach definition and the 3 dimensions and describes it as a condition arising from chronic workplace stress that's not being properly managed. So what's the prevalence of burnout in the veterinary profession? Well, partly that depends on how you measure it, which measurements, instruments you use, for instance, and also what outcome you're measuring. Are you looking at moderate burnout, severe burnout? And probably it differs according to the population that you ask. So Begany and colleagues who did the survey for the BVA last year simply asked the question, are you feeling burned out? And 48% responded yes. The Canadian Veterinary Medical Association did a similar survey and they found 51%, with 31% of those having to stop work for an average of 90 days. Hansesh and colleagues in Belgium found 52% moderate burnout and they used the MBI exhaustion subscale. Regular and colleagues in Finland used multiple dimensions and found 40%. Hatch and colleagues in Australia used the CBI and they found 36% work-related burnout. And Marsdenbroek and colleagues in the Netherlands in 2015 found 27% with high levels of burnout on the exhaustion subscale. But this compared with 13% on the same scale for the general Dutch labour force. And that's the crux of the matter, really, that although these figures vary depending on various things, whenever it's compared with the general labour force, it's always found to be significantly higher in vets. 2 things that correlate with burnout scores are age and gender. Vets who'd been in the profession for longer generally have lower burnout scores. Now, whether that's due to the healthy warrior effect that came from the armed forces, where only those who can cope with the stress of the job for whatever biopsychosocial reasons are the ones that remain, or whether it comes from developing resistance through time in the job, we don't know. It's probably a combination of the 2, and it would be interesting research to carry out. The other factor found to be related to burnout is gender, with levels nearly always higher in women, but when you control for age, that difference disappears, and it seems to be just a reflection of the fact that there are more women in the younger age groups in the profession. So what are the contributory factors? Well, I don't think any of these workplace stresses are going to come as a surprise to anyone in this room. David Bartram and various colleagues have studied workplace stresses quite a lot, and they found the long working hours, the high workload, the making professional mistakes and the unexpected outcomes, high client expectations and negative work-home interactions are all right up there in terms of high stress. Some authors have looked at personality factors. Dawson and Thompson looked at the correlation between burnout and personality traits. They found a high correlation between one of the big 5 personality traits, neuroticism, and burnout scores. However, this was a cross-sectional study, so you can't infer causation and you can't infer direction of any causation or correlation. They recommended using this study in order to filter students before they enter vet school. We've heard from Neil Greenberg how effective that is. There's evidence that it doesn't work. And it may also be illegal with the Equality Act. So what interventions have been trialled? Well, interventions can concentrate on prevention or reversal. It would seem sensible to look at prevention because once you've got high burnout scores, a certain percentage of those individuals are going to leave the profession whatever happens. And interventions can be at the individual or the work group or the organisational level. Well, spoiler alert, they're all at the individual level. We haven't got any yet, as far as I'm aware, at the organisational level. So Sony and colleagues in 2015 studied 236 veterinarians in Gujarat in India. They used the Art of Living programme which is well known over the world as a stress elimination and self-development program. It involves training in specific breathing techniques, meditation and yoga. And they found statistically significant improvements in burnout scores in all the subscales of the MBI. Marsdenbroek and colleagues, also in 2015, in the Netherlands, developed a one-year personal resources development program, so looking at the JDR model. They found that the intervention showed sustained improvement, so they were looking more at prevention. So there was improvement in the MBI scale immediately after the intervention, and also that was sustained for 6 months afterwards. They felt that although it was an individual program, it may have had some effect on the organisation by making people more assertive and more likely to affect change in their workplace, or conversely leave their workplace and find one that was more appropriate. There was also a small pilot study done by Rank and colleagues in 2009 in the USA. That just looked at 12 vets in a sample of 57 people working in animal shelters. They developed a compassion fatigue training program, but they measured compassion fatigue on the ProQol scale, which also measures burnout, and they found improvements in that one as well. So interventions that haven't yet been studied, well, obviously that's the big one, the top one. It's not to say that organisational changes aren't happening. It's quite encouraging to see some of the adverts, the working hours that are now being advertised, or even people saying, you know, tell us what hours you can work and come and work for us. But it hasn't actually been studied to see if that helps in terms of burnout, although one would assume that it would. With the corporatisation of the profession, there's lots more employee assistance programmes now. It would be interesting to see if they have a good effect. Similarly, MMI and RCVS are piloting Schwartz rounds in some practices, and it would be interesting to see if they have a positive effect on burnout. And a study that came out at the beginning of the year by Spitznagel and colleagues they developed a burden transfer inventory for vets. The burden transfer is when highly stressed clients transfer that stress to their vets, and whether there's a way of putting boundaries in place to reduce that transfer, and whether that would help burnout scores would be something interesting to look at as well. So I was writing up this dissertation earlier in the year, and something cropped up on my social media which made me laugh in a hollow, ironic kind of fashion, and I thought, yeah, that sums up this dissertation in about 4 sentences, so I thought I'd share it with you. So thank you for listening. Doesn't it? So thank you for listening. I've got some references here, but if anyone wants any references, please just give me a shout.